When the pandemic hit our area, the Bexar County Jail had about 3,800 inmates. That was in early March. Sheriff Javier Salazar knew he had to take preventative measures to reduce the possibility of COVID-19 spreading in the jail. They included using staff from University Health System to pre-screen inmates before entering the jail, conducting temperature checks on inmates twice a day, booking and housing inmates showing flu-like symptoms separately, suspending the work release program, screening visitors before entering the video visitation facility. New inmates went into quarantine for at least 2 weeks. Eventually, some nonviolent offenders were released to reduce the jail population, and a recovery unit was set up for inmates with the virus who didn't need to be hospitalized. On March 29th, the sheriff announced its first case, an employee. The employee worked in the video visitation facility. The sheriff said that the employee had returned from a cruise on March 15th and was asymptomatic while at work. On March 18th, the employee reported feeling sick. The next day, they were placed on administrative leave. On April 10th, the sheriff's office announced its first positive case among inmates. That pushed the sheriff to provide inmates to wear surgical masks and restrict time in the day room. But inmates said they were using the single-use mask for days. Alejandro Alvaro said he wore his for more than a week despite it being damaged.
It had a hole in it, I had to puncture different holes to fix the mask myself.
We did provide a mask to every inmate. We've asked them to try to use it for 2 or 3 days because we don't have enough supply.
The jail eventually got enough masks for inmates to change daily. By April 29th, 98 inmates had tested positive. On May 4th, 66-year-old Clifford Childs became the first inmate to die due to COVID-19 complications. He was in the jail on 2 murder charges. As of July 6, there have been 547 COVID-19 cases among inmates. Now every inmate gets tested before entering the jail.
In early March, COVID-19 restrictions were put in place across the nation, barring people from visiting their loved ones at nursing homes or other long-term care facilities. On March 31st, Metro Health and the San Antonio Fire Department announced an outbreak at the Southeast Nursing and Rehabilitation Center on South Cross. 12 people tested positive for COVID-19. At least 1 resident had died. The defenders uncovered that a week and a half before the outbreak was announced, an employee raised concerns to multiple supervisors that a fellow therapist had continued to work there despite possibly being exposed to COVID-19.
I do have a big sense of guilt because I feel like I probably should have pushed the issue harder. I think about what if that were my parents or my grandparents.
On April 3rd, Mayor Ron Nierenberg barred staff from working at more than 1 nursing care facility. That's because some of the Southeast nursing staff also worked at other facilities in Bexar and Wilson counties.
If you are a staff member of this facility, you must respond to the notice to be tested. We need your cooperation to stop the spread of COVID-19.
By April 15th, 17 residents had died. On May 11th, Metro Health confirmed an outbreak at a second facility, the Rio Admission Trails. At least 16 cases reported. On June 16th, a family who lost their loved one sued Southeast Nursing and Rehabilitation Center. He was one of 18 who died. And at least 75 residents and 29 workers tested positive for COVID-19. Contact tracing helped Metro Health identify that Southeast nursing staff were working at other facilities, but could not determine how the virus got into the nursing home in the first place.